Hello and welcome to the CDO Magazine series. I'm Jake Dreier with HiLabs, and we are partnering with CDO Magazine, MIT CDO IQ, and the International Society of Chief Data Officers in this series of interviews. I'm here with Roger Jansen, the Chief Innovation and Digital Health Officer at Michigan State University Healthcare. Roger, welcome.
Thanks for having me, Jake.
Great. So as the Chief Innovation Officer, you have the unique ability to try to drive organizations to change. And there's an expression that people love innovation, but they hate innovating. And that speaks to how uncomfortable innovation can be for organizations. So at a high level, what advice do you have for leaders who want to set their teams up for success and actually innovate and change the organization?
I think it's like most things. If we look at innovation versus invention, it's first defining what are you talking about, and so giving people context. I think sometimes we have people come in, whether they're new employees, new leaders, consultants, whoever, and they offer up a lot of big ideas, but they don't appreciate the context for what those ideas are trying to accomplish. And they often also, by talking about so much innovation, sometimes negate the benefits of the past and the way that things have been done. And so I try to talk to people about innovation isn't an indictment of where we've been. It's encouragement about where we can go now that we've learned so much. And so I think one of the things that leaders often do is they get caught up in the idea of always having to have all the answers. And we almost have this paternalistic view: when we're kids, our parents know the answers, then our teachers know the answers, and our professors know the answers. And suddenly we're leaders and we're supposed to know the answers. But innovation is kind of the opposite of knowing all the answers. It's actually exploration in many ways. And trying to take that on with others can be really, really exciting. So I really encourage leaders to talk about context and co-creating. People who are smart and capable rarely like to be told what to do, but they love to co-create with you. And so I think there's an opportunity to do that. I also think we have to remember there's a real big difference between being a manager and being a leader. And I think managers are so focused on doing things the right way versus always necessarily doing the right and necessary things. And if we are comfortable managing, but less comfortable leading, I think what you'll find is maintenance and a tendency to regress to the mean. But if you're truly thinking about leading in transformation and taking exponential growth opportunities, you need to think about innovation. And I think that's where sometimes people struggle. It's easier to do what we know than it is to do what we're not sure is going to work. But I think it's really letting people see context, rationale, and then help them build it with you, not hand it to them.
One of the things that you said in there, which I really liked, was this idea of, you can't throw the baby out with the bathwater. You have to start with what's good with an organization and think about how to expand and grow from there. So you are, as an innovation officer, uniquely situated within digital health. And so I'd say, just at a high level, what are the areas of innovation in digital health? What are the areas that you are particularly excited to explore in that context?
Yeah, I think digital health needs to be much more than just quote unquote digitizing what we already do. And what I mean by that is, right now with COVID, we saw a big uptick in quote unquote digital health with televisits. And sure, that's digital health. But in many ways, that just kind of automated what we already do, and frankly, could have been doing for quite a while. It took a pandemic to move people into that direction. So what I look for when we're trying to expand digital health is, what can digital health offer us that we otherwise wouldn't be able to do? So imagine if we were in a time machine and we could go back 10, 20, 50, 100 years, whatever date you want. If we were just to automate the visit, that's cool, that's interesting, that helps out. But with digital health, what we can really begin to do is accumulate data on a continuous basis. We can begin to understand that while the average American spends about 12 minutes a year inside of a clinician's office, health and happiness and wellness and injury and illness occur outside of that office. We're just claiming their status on those visits. So what we really need to think about with digital health is how do we utilize that capability to gain greater insight, greater awareness, and then use that to help further, whether it's medication adherence or it's healthy habits or it's mental health. What are those things that we can do with digital health to be present and to bring it into awareness and bring new solutions that we couldn't do in just a typical office visit? And I'll give you a really easy example. Most people will go in for their primary care visit physical once every 29 months. Okay, so you want to see somebody every 2.5 years, let's call it. When you walk into that office at that time, they're taking your weight, your blood pressure. That's showing you a 1-second blip in a 30-month journey. What if we can measure those things more continuously and understand what your real blood pressure, your real weight, your real mood were? We could get a much better picture of someone's health and health status. So those are the examples of where I think it can help us do our jobs better, but can also help us help others lead better lives.
You hit on this a little bit, almost as if you were anticipating some of my questions here, but it is one of the things you talked about is how digital health is transforming the patient experience. So what would you say the shifts have you observed in how health plans then need to think about their members, and what shifts do you see potentially becoming relevant in the future?
Yeah, I've got to give COVID credit, as crazy as that sounds, but I don't think we'd be having many of these conversations around digital health and the pace at which we're seeing the change and the adoption if it weren't for the pandemic. So, but I'm also seeing a regression back to the mean, right? We were seeing a really, really high amount of office visits turn into digital visits, and now those digital visits are turning back into office visits, which is doing a lot of things, right? It's driving up costs for the consumer. It's driving up cost at the facilities or revenues at the facilities. But I don't know if it's improving outcomes. And so what I think we need to begin to recognize is, just like every profession in healthcare, in energy, whatever it may be, if we are asking people to do something new, we're asking them to create a different behavior than they've ever had to utilize before. And we're essentially asking them to change their behavior. And behavioral change in humans, unfortunately, we are stubborn creatures. And ultimately, we have to make digital, whether it's in health or it's in fitness or it's in any other area, data analytics, that digital capability needs to help people move towards behavioral change and adoption. And right now, what I am seeing is a bit more engagement from our patients around their health, because we are doing more with remote patient monitoring. We're working with a company called Higgy, who has kiosks around stores, Kroger's, Meijer's, all around the country, where they can do check-ins, but we're also giving severe patients remote patient monitoring devices. We're also connecting into things like the Fitbit and the Whoop and the Apple Watch and getting that information. And what that's at least doing is bringing awareness to what they're doing physically, what we might see from an exercise perspective. But I still think we're a long way in 2022 from where we ultimately need to be. And I think there's some really big reasons for that. And, we can talk about those later on if it's of interest.
Yeah. One of the things that you hit on is, as in healthcare, as we see these issues that patients are facing accentuated, that has an increasingly large impact on health equity. So I'd love to hear specifically about the role that digital health has in addressing health equity.
Yeah, I think obviously it's a really, really hot topic right now. And, one of the things I'd start off by saying is, it's unfortunate we even have to have this conversation, but it's something that I think, the country needs to address. We need to recognize, in I think many ways, that health cannot be treated like buying a pair of shoes or buying a flat screen TV. This is in many ways, to me, an inalienable right, if you will, and we need to do a better job. So those things being said, digital health could be the equalizer, right? Because if we think about health inequities, we can't just think about impoverished or underrepresented communities. We also need to think about rural health, where it's difficult to get access. And so things such as, the top 4 reasons that people go to see a physician are not necessarily the order, but medication refills, upper respiratory infections, skin, blotches or marks, and high blood pressure. All of those can be managed digitally. And lower back pain. So think about digital physical therapy. You're sitting in the middle of Minnesota, which, Jake, you're originally from. I know it gets cold up there in wintertime. It's dark out at 2 p.m, and you've got 1 hour of sunlight in between. And what you probably don't want to do is get on an icy road and go to your physical therapy appointment to have your back measured or stretched out, or your arm. What if we could do that? And we can, through digital medicine and through digital health capabilities, we can do that remotely now. That becomes an equalizer in a lot of ways, because what it can do is we can begin to lower the cost per visit. We can also disseminate the capabilities to a wider range of people exactly at the same time. So it's not one patient versus one therapist. We could have 1 million people sign on to take that, hey, I had a rotator cuff surgery on my right shoulder. Here's the process to go through. And with our cameras and our phones and our tablets and our desktops, the cameras are now able to actually say, are you in the right motion or not? Really, really well. We've actually just engaged a company called Recovery One, who's helping us do that in rural Michigan. So I think that's an example of how it can equalize. I think for underrepresented communities, what we need to do is we need to somehow find a way, and for people who are struggling from a household income perspective, we need to find a way to make these investment in prevention and wellness just as important as the billing codes we get for illness and injury. And if we do that, and I think the government, and I think whether you're a Democrat or Republican, something in between, keeping our healthcare costs down in this country should be a major imperative for all of us. The only way to do that, we learned in kindergarten, whereas an apple a day keeps the doctor away. And yet somehow we have an entire health system that is set up in this country around the sicker we are, the more injured we are, the more wealthy people get in this field. And why would they ever want that to go away? So we really incentivize the wrong behaviors. We've really incentivized the wrong set of billing practices. And I would tell you that there is no physician in a traditional health system billing commercial or government insurance that is getting paid to keep you well.
Thank you, Roger, for joining me today. And for any of you that are listening, thank you for joining us. And please visit cdomagazine.tech for additional interviews. Roger, thank you again.
Have a great day. Thank you.
Bye.